I can't sleep when I lay in bed. Too much thinking in my head. I don't know what to do anymore. But come on now, tell me the score. Is there anything I can do to get out of these tragic blues? I'm a victim of circumstance. I never really had a chance. I lay down and stare at my feet. You know the world has got me beat.
Welcome to today's edition of Mental Health Matters. Today we have a really great show in store for you today. We're going to be talking about dementia, the myths surrounded by dementia, and the symptoms of dementia and the different types of dementia. Here I have on my show with me today, Sharon Spots. Thank you for being on the show today, Sharon.
Well, it's my pleasure, Jesse. Thank you for inviting me.
Okay, Sharon, could you just kind of tell me a little bit about yourself and how you kind of got into the business of senior care, so to speak?
Okay, I'd be happy to. Actually, Jesse, I got into this industry the way many of us do through having a parent that needed to have help. I had two. I was actually in marketing in the Bay Area, and about 2005, I could see my parents were going to be needing some help. So I moved here, none too soon, because I found that my dad was exhibiting signs of dementia. But back then, I didn't have a me, so I didn't know what the signs were, what they meant, what was coming down the pipeline. I was kind of thrown into all of this. Over the 10 years, I not only learned from my experience with them, but I took classes. I had an in-home healthcare agency, and I sold that when my folks got very ill, and I got my certification as a certified senior advisor. So I do senior care planning and management. I do a lot of educating the population on issues that are pertinent to seniors and their care. My favorite topic being dementia, because not that it's a fun topic to talk about, but there are so many myths, as you said, surrounding it. People do not understand it. They do not know how to cope with it and cope with what's happening with their loved ones.
Yes, well, I personally know you're qualified to talk on this subject because just so the community knows that I used to work with you as a director in her company, so we definitely did a lot in regards to dealing with the seniors and just kind of helping them with the level of care that they need. So tell me, what is dementia? What is dementia? Okay,
this is going to be fun to talk about. Actually, dementia, and this is as complicated as my explanations are going to be, it's a mental deterioration, and it results in cognitive impairment, and that includes memory loss. Now, most people are not familiar with that term, cognitive impairment. It's about thinking.
Yes.
It means, how do you process information? How do you learn? How do you think? How do you plan and organize? How do you communicate? All of those things that are involved with thinking and experiencing your senses. So, for instance, you might not understand that you're tired or hungry. Some dementia sufferers do not, and that is cognitive impairment. If you're getting lost or disoriented, or you can't remember what you had for breakfast, that's cognitive impairment. So just briefly, I'd like to explain to our viewers kind of how dementia works. So think of your brain as an onion. Okay, the onion has lots of different layers. Dementia is insidious. It affects the short-term memory, so it's affecting those outer layers. So as you're peeling off the layers of the onion, that's what's happening in your brain, is those outer layers of memory are getting peeled off. And guess what? Once those layers are gone, they're gone. You're not going to be able to glue them back again. That's very important for people to understand, because most cases of diseases with dementia symptoms are not treatable. There are some we'll cover that in our discussion here, but most are not. So you have to understand that you're dealing with a different world here.
So I like your illustration of that because, you know, I know when we were working together, I know we've had clients that had dementia, and I know that their loved one had a hard time dealing with them and even understanding what dementia was. And so we were able to kind of step in and really educate them and assist them with better caring for their family when we wasn't providing the care. And so what can you tell the audience or the community about dementia as far as how to deal with their loved one? Because, for example, I know when we did something with, I think it was a radio show with Laura Wayman, and she kind of talked about dementia whispers. And she gave an example of this lady who was constantly looking for her red shoe or something like that. But her daughter didn't understand exactly what it is that she was talking about. But because Laura was in the business, she was able to kind of go in and help the lady's family and communicate to them about this red shoe and what this red shoe meant to her mother that had dementia. So kind of speak to the family members in TV land about how they can go about really understanding or helping their loved one.
Okay, I would love to do that. First of all, Jesse, I think it is quite critically important that family members understand that when you have a loved one that is exhibiting symptoms of dementia, they're in another world.
Exactly.
You now are in their wonderland world. You have gone through the looking glass. You are in their world. You can tell them, I don't care how many times, that it is March 2016. They're not going to believe you. They just will cease to trust you. They will see you as the enemy because in their world it is not, and you're lying to them. What's the reason for that? Those outer layers of memory are gone. So if families can understand that, you can start speaking their language. And that is very important because you want peace and harmony. You want to make them feel safe and secure and comfortable. That is of primary importance to them. Just imagine if all of a sudden you started to lose your memory and things just were not the same in your brain. You know something's going on. You don't know what it is, but what is the biggest fear of seniors? The home. Okay, my kids are going to ship me off to a home, so if I show that anything's wrong, off I'm going to go. And plus there's a huge fear and shame factor, and just being afraid of the whole thing, not understanding it, makes it even more difficult. So if they're meeting resistance from you, they're just going to retreat more, they're going to be more combative, it's going to be a mess. But if you can understand where they are and they're dealing with fear, if you can make them feel safe and comfortable and understand that your reality is different from their reality, it's going to make it a lot easier for you to deal with any behaviors that are problematic.
Yes. And I know before I started working for you, I didn't know a lot about dementia and the different type of dementias. And, you know, and it really helped me to better provide services throughout the years as I started working from a management level too. Tell me, are there different type of symptoms related to dementia?
Actually, there are a lot of different symptoms. So I'm just going to give you the Reader's Digest condensed version here. Okay? There's really so many of them. And really, different diseases can manifest themselves in certain subsets of symptoms, but generally memory loss is the one that most everyone thinks of right away. And there's difficulty in communicating, disorientation, confusion, lack of being able to process information. Let me just give you a brief illustration of that. I mentioned I came back here to take care of my folks. Well, my dad did not have too many hobbies. Two of them were watching sports on TV and news and reading the newspaper. He and Mom loved politics. They were up to date on everything. That was their main hobbies, to keep with the news and politics. And I noticed he was not watching TV, and he was not watching his sports shows, and he was not reading the paper. And I made a note of that. I thought, that's really strange. He's been doing that all these years. Why isn't he doing that now? He seemed fine, but again, I didn't know what I was dealing with.
Yeah.
Now I know that he was not able to process that information.
Yeah.
He could not listen to the newscaster and have that blah, 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 blah mean anything. He could not read the words on the paper and digest them and have them mean anything.
Yeah.
He was very good about covering. I thought he was just fine.
Yeah.
But he wasn't. So that's how symptoms can be masked sometime. A few more motor functions. As people progress down a deterioration road of having dementia symptoms, what I learned even after I became a caregiver and had our company is that, you know, I'm thinking dementia affects the mind and the memory and the communication. It affects what the body can do. And why would it not? Because the brain tells the body, it tells the heart to tick. It tells you when you need to go to the bathroom. It tells you when you're hungry. It tells you when you're full. It tells you how to lift your arm, to move your leg. And when those parts of the brain start to get eaten away, your brain can't tell your body what to do anymore. So quite frequently people might start getting dizzy or bumping into things or having balance issues. Quite frequently there's inappropriate behavior. You know, dad might be pinching the caregivers at assisted living, making advantages. I mean, it happens, it happens. So, you know, we tell families, don't be freaked out. It's the disease, you know, dad's not turning into a dirty old man, it's the disease. Paranoia is huge, and you probably remember that. Clients will think everybody's stealing. They misplace things, they lose it, they think somebody's stealing from them. This is so common. Agitation, I can understand that. They don't know what's happening to them, so they're just kind of anxious all the time. In the worst case scenario, maybe hallucinations. So those are some of the common symptoms. You could go to the Alzheimer's website or other various websites dealing with dementia and get more comprehensive lists, but I think that kind of should do it for people to monitor.
So if somebody's loved one, or if somebody suspected their loved one has dementia, or you know, are coming down with dementia, when should they go and take their loved one to see a doctor?
Right away.
Okay,
right away. And that's for two reasons. As I mentioned, generally dementia is not the diseases that are associated with dementia are not curable in 80% of cases, and 20% they are. So if you get to the doctor right away and get the diagnosis for what you're dealing with, for instance, in the case of Alzheimer's, there are medications, Namenda, Aricept, others that can slow down the disease, and then when the disease is progressing, it can make the person more comfortable and deal with these behaviors. In certain cases, they are treatable diseases such as thyroid, even vitamin deficiency, water in the brain, things like that can be curable. So if you don't get to the doctor and have that diagnosed, you're not going to be able to do anything about it until it's too late. One of the interesting, I guess, diseases that we deal with as caregivers, you remember this, and anybody in the industry that is dealing with assessment of individuals and so on and so forth, the care planners, when we have a client, family member call us and say, you know, yesterday mom was fine, and now today she's running around without her pants on. You know, and she's confused, and I think she suddenly got dementia, like, you know, you just catch a cold. And we say, when's the last time mom's been to the doctor? Get her into the doctor. And I know you know where I'm going with this, is because we find that when they have a urinary tract infection, you get sudden onset dementia symptoms. So it is not normal to have suddenly getting dementia symptoms. There's no sudden onset dementia, really. It's usually something like having medication issues, urinary tract infection. So it's very important to get to the doctor, find out what the underlying cause is for the sudden shift in behavior.
Yeah. Well, I noticed in your last response, you kind of talked about dementia, or referred dementia as being, or having symptoms. Kind of explain that to me.
Oh, good. I'm glad you brought that up. Yeah. This is so important. This is so important. People say, my dad has dementia. No, he doesn't.
Yeah.
How can he? There's no such disease. People they don't know that. If you're a lay person and you're outside of the medical world or the healthcare world, people do not know that. I did not know that.
Yeah.
I was just amazed when I started studying under Laura Wayman, got my certification in dementia. There's over 70 diseases that cause dementia. So let me just explain. If I have a runny nose and coughing and sneezing, I could have a cold, I could have hay fever, I could have bronchitis, pneumonia. There's a number of diseases that cause those same symptoms. Same with dementia. There's, as I said, over 70 diseases, and the most well-known one is Alzheimer's disease. That really accounts for probably, and I hope the phones don't ring off the hook saying she got her percentages wrong, but probably, you know, maybe 2/3, 3/4 of the cases are Alzheimer's. And then you've got Parkinson's disease, Hodgkin's, Huntington's, stroke.
Yes.
And right now, with the boomers hitting, people that had histories of drug and alcohol abuse are paying for it.
Yes.
It kills the gray cells, right? And when they're gone, they're gone. So they're really having all of those symptoms. A head injury could cause it. And we talked about medication mismanagement or infections, whatnot. Yeah. So those are some of the more common.
And that's one of the things
diseases
that I was gonna ask you too, because I often wonder, now that you brought that up, is there things that we do in our younger years, so to speak, that contributed to dementia as we start to age? You know, and is there a certain age where people start to catch dementia? Can you be 20? Can you be 27? Can you be 30? Or is it just a disease that older adults primarily catch?
Generally, well, there again, I caution you to use the term catch because you're getting the disease, and the symptoms follow the disease. And generally speaking, because these diseases manifest themselves as we get older, that's the reason older people usually are having dementia-related problems, but younger people can. Somebody can blow their brains out with drug abuse and alcohol abuse at a young age. And I have seen, unfortunately, a number of people that did do a lot of drugs have multiple sclerosis. But you know, that doesn't necessarily have symptoms of dementia, but it's a deteriorating disease. And I use that just for example, that, you know, people can wind up having, say, being diagnosed with Hodgkin's or Lou Gehrig's at earlier ages than, say, if they had the proclivity to it, they might be getting it, you know, earlier because of these compounding issues, drinking, doing drugs, hard living. But generally it's because as we get older, our bodies are breaking down and those other diseases manifest themselves. But I tell you, like with anything, diseases such as Alzheimer's, people are being diagnosed at an earlier age than ever before. Ever before. There's, of course, better methods of detection now. That has a lot to do with it, but I just think people's lifestyles are different now, and that, you know, I'm not going to get into all of that because then the phones will ring off the hooks, you know, all the reasons, but you know, just use your imagination of all the changes of lifestyles that could be contributing to different diseases. But to fully answer your question, an injury at an early age definitely could affect. I'm trying not to smirk. My poor ex-husband, his brother whacked him. He was coming out of a tent. His brother whacked him with a 2x4 so hard his head started to ring. And I just kind of wonder if that didn't cause some of his later year problems. You know, it's not funny. It's not funny at all, but the way he tells it was. But things like that we don't even think about. So,
exactly.
Yeah.
And you think about, and I can't remember, and I should know this, but I don't. Think about Muhammad Ali.
Yes.
That's a prime example.
That's an excellent example.
You know, of him getting hit, you know,
bam, bam,
throughout
bam,
the years, you know, and look what's going on with him, you know. I think about Michael J. Fox is another. I think he was diagnosed with Parkinson's disease.
Parkinson's, yes.
If I'm not mistaken.
Early age, yes, that's a great example.
Yeah.
Much earlier age than in most cases.
Yeah. Is there a cure for dementia?
There's only, there again, we're going to reiterate, out of 80% of diseases that have dementia symptoms, there's no cure. And this is according to Johns Hopkins University. 20% there are. So that would again include like urinary tract infections, thyroid, hypocephalus, water of the brain, vitamin deficiency, some of the things that I mentioned. Those are treatable conditions. They're very short-term memory or dementia symptoms, and you treat the disease, the symptoms go away. But in most cases, Jesse, unfortunately, in 80% of the cases, if you have a person with dementia, the disease behind the dementia, such as Alzheimer's, Hodgkin's, Parkinson's, whatever, is not curable. Or oftentimes a stroke, sometimes our pastor had a stroke, and he had loss on the left side and had some mental issues with a lot of physical therapy. He made almost a complete comeback. But in many cases, the stroke is severe enough that you're not going to reverse it because, again, once those layers are off that onion, you're not going to glue them back on. And your brain just doesn't grow those layers back, not at a later age especially. So that is why discussions like this are so important. It is so hard for families. They go in denial. They want it to be the way it was. We're used to medicine being able to cure things. Right now it's inconvenient. Johnny's got a broken leg, or somebody has this, somebody has that. Even diseases as severe as cancer, prostate cancer, breast cancer, remember, those are very horrendous at the time they're happening, but so many get cured from it, and then life goes on as normal. With dementia-related diseases, no. You need to understand that, make the adjustment, go into their world, their reality, understand the behaviors, understand the disease, work with the experts. You can get through it. You can make it easier for your loved one. You can make it easier for yourself. I let people know that you really can't do it by yourself. Get into support groups, take classes on it, get the material, reading material. And you, and I know that, you just mentioned that, what we did not know ourselves going into this. And there's so much out there to understand. And once you do, it can make all the difference, can it?
I have a... and I'm going to try to be really careful how I say this, but I have a family member that had a stroke a while back, and when I talked to my mom on the phone, and I asked about this family member constantly, and my mom, you know, always tell me that, oh, you know, this person, they're okay, and then my mom will say, well, you know, they're not all the way there, you know, something wrong with their mind, and, you know, so I know there's something, some memory loss going on, you know, but nobody's taking the initiative to get this person to a doctor or to get the medical treatment that this person needs. And what's happening is the person is kind of slowly but surely going downhill. You know, very, you know, at a slow rate. And so it's sad because we don't, you know, at least for some of the people in my family, just being transparent here, you know, we don't always go and get the preventative treatment that we need. Even if we do see those symptoms and we do see the signs, we just kind of, okay, that's just how this person is. But no, people can actually get help?
You have really raised a very important point. My dear dad was from Arkansas. And in his world, at the time where he was raised, at the time in history, people did not go to the doctors. That meant something is wrong with you. And there's shame in that.
Yes.
As a girl, I think the only 2 times we went to a doctor was, well, actually they made house calls back in those days. I've just dated myself with. We had chicken pox really bad, and the measles, and the doctor came to the house. Other than that, I didn't see a doctor till I was on my own and was having a baby.
Wow.
We just did not go to doctors or dentists, you know. It was not in his world, and it kind of sounds like there might be some of that going on in your family. It's just a mindset, and people are afraid. They don't know what to do. They're afraid of acknowledging it. That's the denial I was talking about. Oh, things will be fine, they'll get better, or it's not really that bad. And meanwhile, your family member is going down the slippery slope. The sad thing about this case, Jesse, is that person might be having some pain or other issues. Those are not being acknowledged and addressed. And it is very sad. That person's probably afraid, scared, uncomfortable. The needs are not being met.
No, they're not. They're not
so,
at all.
Yeah, you can take a vacation and go check on that person and help. And your family, this is important too. You and I both know you're now quite an expert on senior care and senior issues, but families never listen to family.
Oh, no, they don't. No,
They're
not at all.
Yeah, Jesse, folks, Jesse and I would always have families say, oh, mom's not going to talk to you. They're going to be resistant. She's going to do this. She's going to do that. She'll be fine. She'll be fine with it. She will be different with me than she is with you, and especially when they're paying for a service, or, I mean, they're just resistant to family members. So I could go out there with you, and they're going to listen to me.
That's exactly right.
But you're Jesse. They're not going to listen to you.
They're not going to listen to one word. Trust me, from me.
Yeah, there you go. That makes it difficult.
And another thing, too, you know, because the stigma that's attached to any form of mental illness.
Yes, thank you.
That has a lot to do with it, too, for sure.
Doesn't
you know,
it? Yeah.
Because, you know, they got a image to uphold, and, you know, we don't want people to know our business. But guess what? The people that has this diagnosis or this, you know, disease is the one that's actually suffering from this.
Exactly. And you're so right about the stigma. In the old days, they just, you know, put somebody in the back room and kind of hid them from public sight. But I am glad you're bringing that up, because we need to have compassion. We have to understand that these are not behaviors. This is not a bad person. Dad's not a dirty old man because he's, you know, hitting on all of your friends. No, this is a disease, just like any disease. And you have to deal with these symptoms of dementia as what they are. They're symptoms of a disease. And to have that humanity and compassion, if we start losing that as a society, what do you have left?
Exactly.
You have to be able to realize that it's not your shame, your embarrassment. It's that this person has a disease, and we want to make them more comfortable. We want to help them through this. So we keep kind of saying this, but we want people to get it, because there is no shame. If we take that factor out, hopefully we're going to be able to help more people.
Exactly. I kind of want to speak on the bathing versus the showering. Because I know when we were sending our caregivers out to provide service, I know some of the family members had issues with that. You know, some of them would try to get their loved ones in the shower or bathing, and sometimes they would have, you know, a hard time with that. So we had to go in and kind of educate them on that. So kind of talk about that.
I will, because, you know, sometimes you learn these things and you don't know if they're really going to work. But first of all, I do want to say I give complete thanks to Laura Wayman. She's a good friend and a dear person. She is really the expert on. She's the dementia whisperer. And everything I've learned is first through her, and then of course experience. But I've been in her presentations many times, always learned something new. So when I started giving presentations, I checked with her, and I like to give her full credit. She said, no, Sharon, she said, I just want to get the information out there. You're helping people. And that's why I love working with Laura. I'm the same way.
Yeah.
You know, get the information out there. So this is an example that I learned from Laura, and then you and I used it with our client. Okay. Yes, usually the people that have dementia have water phobia.
Yes.
They're, again, losing their ability to understand what is happening, and they're retreating back into a shell because there's too much information out there. They can't cope with going to a restaurant and all the sights and the sounds. It's too much information, so they're retreating. So to go in to a bathroom and take a shower, not only is a lot of steps, but back in the day when they were being raised in the 20s and 30s, it was an agricultural society. And so when did people take their baths? Saturday night or Saturday afternoon. They would go out, you know, to the hoedown on Saturday night and go to church on Sunday. Did they have showers back then? No, they had a barrel or they had a tub. If you had a family of 11, the youngest one was taking the bath in all that dirty water that everybody else had already used. You know, so they were used to taking a bath. So now fast forward, you're hauling them into a shower, you're turning it on, and even if you have the hose sprayer device, it's still scary. But especially if the shower's up here and all this water's coming down at them, it terrifies them. And that is why you're meeting with resistance. Again, I just cannot emphasize enough, when you're dealing with a behavior problem, rarely is it the issue itself, it's something behind it. So when, you know, mom's fighting you, she doesn't want to get in the shower, it's not that she doesn't want to get clean, or she's terrified of the water, and she can't tell you. So we learned that, okay, just get a what are those plastic sink basins, fill it with water and start washing them from the feet up. And then if you have the hose thing, you could just hose them from here down and then just wash their face. And we had that with our gentleman client. And the caregiver said, I can't get we'll just call him Mr. Ross. Mr. Ross into the shower, and he used to like to take a shower. He always used to do it just fine. And I think you told her to do that. We had just had a training on dementia. You told her to do that. And boom, she said, come on, Mr. Ross, we're going to go in and take our bath. So you don't ever refer to it as a shower. You always call it a bath. And you make sure they don't get the water on the head. You know, just kind of from the feet on up, problem solved. And it was like, wow, that really did work. Isn't that cool?
Yes. And you know what, this is why I love working in a field where we can provide education and information to the community, because a lot of people, they really don't know. They really don't know how to deal with a lot of the stuff that's going on. No,
they do not. I know I did not.
Yeah, exactly. But you learn through trial and error.
That and Laura's presentations and a lot of education. Yes, and that's why I do what I do now, because families, they don't recognize the symptoms, they don't know what to do, there's stigma, and I will share this, we're talking about being transparent. What's really helped me with the families of clients and the clients themselves is that I, like so many, out of 1 in 5 women now have breast cancer and go through chemo. And chemo brain is real. I was starting my company with chemo brain. Oh, good heavens. I had some divine help with that one, but I knew it wasn't the same. So, you know, fortunately I use a lot of spreadsheets and Post-it notes and things like that. But when I would go in and I would tell clients that I can understand how scary it is to start having short-term memory loss, because I had chemo and I have chemo brain, and I do it with just matter of fact, there's no shame in it, I don't need any sympathy for it, it's just, it is what it is. But I understand how frustrating and scary it is for you. That changes the whole game right there. They just start opening up, and it's like, oh, okay, well, she cares, she understands, and it's okay to have this. I don't have to be embarrassed. I don't have to be ashamed. The same thing on another note, the same thing applies when, and I know you remember this, when, you know, women that are having to wear Depends, they're very embarrassed about that. But they also love Whoopi Goldberg and Sister Act. The older ladies love that movie. They love it. And then when you tell it, well, Whoopi Goldberg did all of these commercials that 1 in 3 women sprout leaks. 1 in 3 women over 50 sprout leaks. Oh, it's okay now. You know, Whoopi Goldberg has that problem. And it's the same thing with dementia. It's like, oh, okay, I don't have to be embarrassed now. I wasn't bad. I didn't get this disease because I was a bad girl. That's really what a lot of it comes down to. You know, they think they did something that caused it. So.
People that have dementia, are they able to make decisions for themselves, or is it best for them to have someone, a loved one, to, you know, help them make, you know, decisions?
That's an excellent question. And it is very hard to go through the aging process as an older adult if there are not family or somebody there. Now there's starting to be aging communities where people can get connected with others, so there is somebody there. And I encourage that, because let's look at this from the legal and medical aspect. In the early stages of dementia, someone can be quite capable of living independently, making their own decisions. I have a client right now who has early stages of Parkinson's, and she's exhibiting some memory loss, some little bit of confusion, but she's a bright woman, she's doing just fine, living independently. She does her own bills, makes her own decisions, getting her tax stuff together. Down the road, we both know that she's going to lose a lot of that capability, but right now she can still do that. She's in the early stages. Later stages, probably not. And that kind of leads into another one of our questions about legal capacity, if the courts recognize that. First of all, everybody in the whole world should have somebody be their power of attorney. You should have your power of attorney, and you need to have both the legal and the medical. People do not necessarily understand that. You need a power of attorney over your financial affairs, power of attorney over your medical affairs. Some families have, in fact, one of our clients had that, where the son was back east. He was an accountant, so he had financial power of attorney. The daughter was the caregiver here with the father. She had the medical power of attorney, so she could take him to the hospital and make the decisions. It can be 2 different people, it could be 1. But if you're over 60 or 65, you should have all that paperwork in place, because when the question of dementia comes up, it's loaded. And it has to do with the capacity. Can the person make rational decisions? Do they understand what is happening? Do they have relevant capacity, or requisite capacity? And the courts are going to look at this, but most of the time, once that doctor writes down a diagnosis of dementia, that's all she wrote. Most of the time, they're going to say, no, they got dementia, they can't make decisions, it's not legal, it's not valid. Depends on the state, depends on the courts, depends on the judge. Even if they determine that someone has requisite capacity, they could require a doctor's certification, witnesses. It could be time consuming, and it can be contested. And that can be very messy too. So I just say, don't go down that rabbit trail. If you have a family member that's over 60 or 65, it's hard to have these discussions with people. They don't want to talk about any of this, or death, or any of these related subjects, but it is very, very important. And that's where third-party professionals like you and I can help the family with this. Because once they have the dementia, especially if it's later stage and they don't have relevant capacity, guess who's going to make those decisions for your loved one? The state.
Exactly.
The state's going to be the one to make all those decisions. And do you think with 10,000 baby boomers a day turning 65 that they're going to have case overload?
Yeah, absolutely.
It's like boom, 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 or it could be months before they get to your parents. So I'm glad you brought that up. That is an extremely important point.
I know I facilitate a workshop called WRAP, which is Wellness Recovery Action Plan. And it's an 8-week workshop. And during the workshop, we have a section in there where we talk about the crisis plan. And so during the crisis plan, we have people to delegate different responsibilities to their supporters, you know. And so when I'm teaching this class, a lot of people kind of struggle with that part because nobody wants to deal with them being in a crisis or somebody making a decision on their behalf, you know. But we tell them how important it is to put this plan in place because you just never know. It could be a car accident, it could be a stroke, it could be anything that could happen. And for me, in my opinion, it's better to have this in place and have your wishes wrote down and respected as well, you know. But sometimes people, they don't want to deal with that. They just don't want to deal with the fact that, okay, something possibly may happen to me, or I'm not going to always be this sharp, you know. And the truth of the matter is, we're all getting older every year, every second, every minute. We're getting older, you know.
We all have an expiration date.
Yes, we do.
We just do. Do you remember Miss Olivia from the church? I'm going to use that example to illustrate this, okay? Because I think, well, first of all, I'm at the tail end, but those who went through World War II, we call them the Great Generation, and we call them that for a reason. None of us that are at the tail end of that weren't involved, can really understand the sacrifices that generation made, how tough it was. They didn't know that Hitler was going to be defeated. We know that now, it's in the history books, but they didn't know that. They were just out there working hard, taking care of business. I mean, they were a great generation, and that fostered a very, well, that and the fact they came through that depression also, a very rugged and independent spirit. They had to for survival. So when you have that kind of ruggedness and independence, it's very hard to address these topics of who am I going to have to take care of me? No, I've always taken care of myself. I can still do it. I'm going to do it to the end. Grandpa did, you know? But you're right. None of us know when there might be a stroke, when there might be a car accident. Again, that's where having my experience I share with people. I've always been independent. I've taken care of myself my whole life. Was breast cancer in my script? Heck no. And I'm telling you, I got to the point where people were driving me to the store, and I was determined I wasn't going to use one of those scooters, right? So I hung onto the shopping cart and I marched down that aisle. At the end of chemo, I was riding one of those scooters, but guess what? It was a lot of fun. As I went, So, you know, you can make the best out of it. But that generation is not going to want to deal with these issues by and large, because it is painful, it's hard, or especially for people who do not have family. Or personally, in my case, I decided to change my power of attorney and my will and my trust because my son went into the twilight zone. He had been my executor, and he was not making good decisions for himself. I didn't want him to be making decisions for me. So people who have no one aren't going to make them. They're going to put it off.
And I mean, and I think that's important. I know one of the comments that one of the people had made in one of the classes that I taught, they said that, oh, well, I don't have any supporters. You know, and I was encouraging them, because when you say that, you automatically think about blood relatives. You know, that's the first thing come to mind is, you know, but I explained to the person, I said, well, it can be a friend, it can be a best friend. It has to be somebody that you trust to make the best decision on your behalf, or somebody that's going to respect and do exactly what you put down here on paper.
Exactly, well put, well put. And I'm really glad that you brought that up, because I just gave a presentation up in Auburn the other day, and the lady was telling me the same thing. Her son was all set up to be her executor, and he went AWOL too, into the twilight zone. he got this new girlfriend, and she said, well, every time they come visit, I feel like she's cataloging everything I have.
Yeah.
You know, so oftentimes maybe a friend is the better decision, because haven't we seen in many families that have gotten along, there's a death, it gets ugly real fast, doesn't it? Isn't it amazing, Jesse?
Very.
They've gotten along their whole life. How sad now that you're
Yeah.
going to fight over stuff that you're not going to be able to take with you
Yes.
anyway. So you never know what's going to happen, say, with your children or somebody. So having a friend, my friend is younger than me, so I know she's not going to pass away before me.
Yeah.
And I know she's going to make the decisions that I want. So I do recommend that. There are other avenues. There are fiduciaries that can take care of it. Wells Fargo Bank has a program for seniors and banking and handling their fiduciary responsibilities. They'll handle that. There are independent fiduciaries. There's just lots of different options. But the fact is, you really need to take care of it, because if you do not, the state's going to take care of it for you.
Yeah.
And there's nothing worse than being in a situation where you're not able to get out of that hospital bed, or your brain's not working right, and you're kind of aware of what's happening, and you don't like where they put you, you don't like that hospital, you don't like the nurses, and you have no choice.
Yeah, but to go along.
Exactly, but to go along.
Yeah. I want to kind of talk about this too. I know when we were working together, we had a situation where one of the family members, they was having a hard time with the loved one, because I know we was explaining to them to kind of go along with the loved one, whatever the loved one is talking about, because in their world, this is their reality, you know, and so they had a hard time because they felt like they were lying to their loved one.
Oh, this is such a good point.
You
This
know,
is such a good point.
And so let's speak on that a
Oh,
little bit.
thank you. Yes, there's some people out there teaching about dementia, and I respect integrity. That's part of who I am and my business. I'm being a certified senior advisor, and
I
you
can
know
attest
that
to that.
too.
Oh, yeah. Oh, yeah.
Jesse and I both, have
Yeah.
high set of ethics, and so lying isn't something we're comfortable with, but think of it as just entering their world.
Exactly.
And dealing with their reality. It is not a lie.
Yes.
So I'm going to use this example. Okay, it's dinner time, and mom is at the front door, and she's waiting for mommy. And you're going, now come on, mom, it's time to wash up and come to dinner. No, I'm waiting for my mom to pick me up. Now you can tell her, I don't care how many times that your mom has passed away, you're an adult now, she's not coming to get you. She's not going to listen to any of that. She's going to think you just fried your egg, right?
Exactly.
She's not going to believe it. So we distract and we go, yes, I know how exciting. And guess what? She called me and wanted me to have you ready for her. So can we go in and wash up so you'll be ready for her? Okay, off you go. She washes up. 5 minutes later, she's forgotten all about it, and you're going into dinner. That's not a lie. That is meeting her where she is.
That's exactly right.
In her world, because she has now regressed back to being a little girl. All those other memories are gone. So why get her upset? Why get yourself upset?
Yeah, and it reminds me growing up as a kid when, you have people who tell their children, oh, the tooth fairy is going to come get your tooth. And so you put the tooth under the pillow, and you wake up, you may have $1 or $2. It's the same thing.
It's magical, isn't it? And
Yeah.
exciting.
Yeah,
You're
Santa
doing
Claus,
the same thing.
Easter Bunny.
Exactly. You're doing the same thing. Your parent. You're meeting them where they are. So have fun with it. Make it fun. For instance, it's time to go to the doctor. We were talking about communications. One of the points I bring up about communication. Never to get impatient or frustrated, because they cannot handle that. They're dealing on their own time. You've got an hour for lunch. You got to take mom to the doctor and get back to work. You get to mom's house, she's in her nightgown. Mom, hurry up. You're going to get met with resistance every time. Better approach is take some personal time, take 2 hours, get there, have plenty of time to relax, and when mom starts resisting, say, oh, hey, mom, I have an idea. Let's get the doctor thing out of the way, and then we can go to Mel's and have a chocolate milkshake, because she adores them. Okay. I mean, it's just like the bathing thing. It works. So if you can do that, if you can go into their world and meet them where they are, you're going to have a lot better luck with them, and they're going to be happier, and you're going to be less stressed.
Yeah, and I think too also it's about being creative too.
Oh yes.
You have to be creative, and you have to be able to deal what's really on the table.
Exactly.
And what's on the table is, your loved one is not the same. So just as well as they are adapting to what's going on with them, you have to adapt as well as to what's going on with them.
And they're going to sense that.
Yeah, oh yeah, absolutely.
It's like a person who is sighted and they lose their eyesight, all those other senses kick in and become enhanced.
Yeah.
And I know that you know this from our clients is they are starting to lose cognitive ability. They become like empaths. Didn't we tell our caregivers, if you've had a fight with your husband or your wife, don't go into someone who's a dementia patient. They're going to pick up that stress and that tension.
Exactly.
They have enough on their plate rather than worrying about why are you upset because they now care for you.
Yeah.
They're going to pick that up. So if you think that your parent is, you're ashamed of this dementia thing or whatnot, you are not helping that person because they're going to pick up on that.
Yeah.
If you're upset, if you're anything, they're going to pick up on that. They're going to sense your mood the minute you walk into the room. So you have to adjust that to them. And that's part of the whole communication process.
Yeah.
If you can adjust to that and treat them with love and respect and understand that they are adults and they are people. Don't talk to somebody else about them in the room and not include them.
Yeah, exactly.
They know. They know what's going on. So, treat them like you'd want to be treated, because guess what, folks? If you have a parent that has a disease with dementia symptoms, there's probably a good chance that you might get the same thing as an adult. And how your children see you treat your mom or dad with that, exactly what's being modeled to them.
That's exactly right.
Yeah.
That's exactly right. And it's interesting because I have a friend who, her and her mom kind of collide. And her daughter doesn't have a relationship with her mom at all, And so I sometimes I worry about that. I was just talking on the phone the other day about, if something happened to you, is your daughter gonna step in and help take care of your mom? Because her mom has a mental diagnosis. And her response was like, Jesse, honestly, I don't know, And so you're right. And I kind of think that too, like, okay, because how she see the way you treat your mom and you guys' interaction, it's a strong chance that as you start to climb the ladder in age.
Exactly. It happens in more cases than not.
Yeah.
But nevertheless, we're dealing with people as people. And oftentimes, if there's problematic behaviors, you have to look at why. What trauma did they undergo? What happened to them? And you can get a lot further in your dealings with them. For instance, we hear about people repeating behaviors. Mom is repeating the same thing over and over and over and over again. Does she really forget that quickly?
Yes.
Probably, maybe she has forgotten that quickly, but really it's not about that.
Yeah.
She's probably not even processing the information, what you're saying. She's not even understanding it. What it is there's something else going on. And I am going to use the illustration of when you have an infant.
Yeah.
The infant cannot communicate to you, so the infant cries.
Yeah.
Could be hungry, could be needing some attention, could be afraid, could have a messy diaper.
Yeah.
You're trying to figure out why infant is crying. Same with mom or dad on problem behaviors. You have to figure out what is causing that, and when you can figure that out. So if somebody is calling over and over, I need help, and I've seen this in skilled nursing facilities. It's really about I'm scared, I need attention, I'm constipated, I'm hungry. You figure that out, and then you're going to figure out why the behavior.
Yes. Well, Sharon, I so enjoyed your time on the show today, but we are definitely running out of time. And I'm hoping that somebody see the show and they can get this information, and I'm hoping that it will really, really help them and their loved one. And that is it for today's Mental Health Matter. If you have questions about the show, and if you enjoyed the show, and if you just want to get a copy of the DVD, you can call 916-366-4600. And thank you for watching.
When I think of where I've been, the good times and the bad, on a scale of 1 to 10, either way I'm glad, 'cause I'm not alone. As I'm reaching for the phone, your voice is there, you really care, you're my comfort zone. Sometimes when I'm lost, crushed beneath the pain, though I can't afford the cost, I just smile and play the game. But there's a healing place where I cannot pretend. Your smiling face, your heart's embrace heals me again. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny that I'm not alone. 10,000 times I've known my best bet is that first step for hope. Trying to stand tall, I'm haunted by the past. With my back against that wall, one thing is clear at last. The kind of love you show to me flows from an endless stream, with shores so wide it won't subside. My mind had never dreamed how I'm not alone. Even when I'm on my own, your gentle touch is much too much to let me roll. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny how I'm not alone. 10,000 times I've known my best bet is that first step for hope. When I think of where I've been, the good times and the bad, on a scale